So why do we bring up the meninges? Well, there's a layer between a space actually, like so this area between the bone and the dura mater is something we call the epidural space. And those of you who have some medical background or maybe have had epidural anesthesia, this might sound very familiar because this is referring to that same the epidural space. So what we have with the epidural anesthesia, what we notice is that we're going in between these spinous processes and then going right above here. So when they do this, give this epidural anesthesia, they're not going to jab it all the way and damage all these nerves over here. They're going to insert that needle into this epidural space again, and then they're going to deliver the anesthesia to this area. So this is, and yeah, so why might you have a epidural anesthesia? This is often commonly given for women who are who are delivering babies. Of course, I can't experience that myself, but from my friends who have had this done, one of them, she says like, yeah, it was kind of weird. Like I couldn't feel anything down there. Like it was like everything below my waist wasn't there at all. So she had an easy delivery because of that, because she couldn't feel anything. So she said it was kind of weird, but luckily she had a painless delivery. So this is a common reason why they give epidural anesthesia to help with labor and delivery. And so over here we have the subdural space. So epi, again, remember, meaning outer and above. Then subdural, so sub meaning below. So just more deep towards the dura, we have the subdural space. And so what if we go one layer deeper and go below the arachnoid layer? We end up in the subarachnoid space. And highlight this part because why the subarachnoid space is very important. It contains a very important fluid we call cerebral spinal fluid. So you might have heard of CSF. Well, that's what cerebral spinal fluid is, and it's located in the subarachnoid space, both in the spinal cord and the brain. Okay, so here's another procedure. So cerebral spinal fluid. Say you're a physician or a nurse or some medical professional, they think there might be something like affecting the nervous system and they want to take a sample of the cerebral spinal fluid. What's the way they can get the cerebral spinal fluid? They have to get it out somehow. So they have to get a needle and put it in that subarachnoid space. So it's more than the epidural. You have to go through multiple layers. You have to go past the dura. You have to go past the arachnoid mater, and you don't want to hit the spinal cord because this is where nerves in general. I mean, we're finding out there is some regenerative activity, but nerves are very slow if they regenerate at all. Now, so the thing is that this is why with the lumbar puncture, or commonly also known as spinal tap, this is why you try to go low, not because you want to make it more painful or anything, but you want to miss that spinal cord. You could try to do get cerebral spinal fluid from up here, but which are you more likely to hit a nerve or hit the spinal cord? Up here, or where you have the cauda equina, where you have these thinner structures. So this is why you typically do a spinal tap in the lower lumbar regions between this L3 and L4, because you don't want to damage these nerves by hitting them and causing trauma with that needle. Yeah, I've never had this lumbar puncture, but I heard it's pretty painful procedure, and this is why you don't want to do that. So if it's so invasive and so painful, why do we even need to do a lumbar puncture? And one major reason for doing that is, what would you call inflammation of meninges? Yeah, so if you can mess up, it could possibly cause nerve damage, or worst case scenario, yeah, you want to paralyze someone. So this is why you don't want to you don't want to hit nerves when you're doing a lumbar puncture. So what would you call inflammation of the meninges? Well, whenever you have an inflammation of a tissue, the common or the root word for that is itis. So itis. So meningitis, correct. Everyone's getting that. So meningitis. So cerebral spinal fluid should be sterile. Like this is actually like one of the pure. Like I'll get. Well, I don't know if I have enough time at the end of this lecture, but cerebral spinal fluid is made from your blood plasma, but it undergoes multiple layers of filtration and through multiple layers of cells and tissues, so it's ultra pure. It should be sterile, but sometimes you get something like a virus or a bacteria, or sometimes in weird like fungi that can infect it. Something is infecting your central nervous system and causing this inflammation. And this is a pretty graphic one. If you're, or I should have given a warning for this one. So look away if you don't like the server images. But yeah, look at that. All of that redness, all that bleeding, all that vasculature. So this is really inflamed these tissues over here. And I think this is like, I hope that's pus too. But many possible causes is something infecting that area. So fungi can do that, parasites, viruses, bacteria, especially Neisseria meningitis. So if you're taking microbiology, you know, like there are some pretty harmless species of Neisseria, but if you remember from microbiology and you're taking it, you're gram-negative diplococci or gram-negative cocci in general. Neisseria is one of the nasty ones. And there's another one, not only is that they're the meningitis species, but there's also Neisseria gonorrhoeae. So if you get gram-negative cocci on a chocolate agar, that's probably something pretty you should address. Either you have meningitis or you have gonorrhea. I'm not talking to you, Siri. Alright. Yeah, Siri is not comprehending this stuff. Okay, so meninges and spaces. So meningitis, oh, that's pretty nasty. But this is why, if you do have meningitis, they might do a lumbar puncture to see, like, hey, especially if there's a viral one and they don't see it's elsewhere, they'll be like, okay, do we see viruses, bacteria, or inflammatory molecules in your CSF? Okay. So meninges and spaces, these are the ones of your spinal cord, but you also have meningeal layers in your brain. We'll cover the brain more in detail in the next few lectures, but the brain also has meninges, and the brain also is surrounded by your cranial bones. So you have bone and your brain, and between these you have the meninges. So you have your pia mater, closest to the brain. You have the arachnoid mater, that's more superficial to that, and the more superficial layer of all the three meninges is the dura mater. That's not coincidental. So the thing is that the meninges have the same order of layers between the bone and the central nervous system, regardless if it's the brain or spinal cord. So the spaces above the dura mater and more superficial to that, with the epidural space, we have the subdural space between the dura and the arachnoid, and deep to the arachnoid mater, we have the subarachnoid space. And hey, the cerebral spinal fluid is also contained within the subarachnoid space of the brain. Now, let's put these together. And this is another reason why I brought up the development of the brain early in this lecture. Because even though the bones aren't fused, what happens is that these spaces and these meningeal layers, so the dura mater of the spinal cord is continuous with the dura mater of the brain. And the arachnoid mater is also continuous of the spinal cord is continuous with the arachnoid mater of the brain. And same with the pia mater. The pia mater of the spinal cord is continuous to the pia mater of the brain. Same with these spaces. These spaces, the subarachnoid space is continuous, and so it forms a continuous area of space for this cerebral spinal fluid to circulate. Same with subdural space and epidural space. So the main point from this side is that these spaces and these meninges are continuous, regardless if it's in the brain. And again, this is a reason why, because again, we have our neural tube formation, so they all develop from the same common structure. So this is why they also share all these meningeal layers and spaces as well.